All right, so we're going to be doing a deep dive today on some research from the National Initiative for Care of the Elderly in Canada.
Okay.
And, it's all about COPD in older adults. I
Interesting.
mean, we hear about COPD a lot,
Right.
but it's like the third leading cause of death in Canada,
Yeah,
which is a lot.
that is.
And, and the numbers really jump as people get older.
Oh, wow.
And there's so much in this research that's kind of surprising.
Okay, well, let's unpack it then.
Okay, so like you were telling me before that a lot of people have COPD and don't even know it.
Well, yeah, a lot of people are living with it without a diagnosis.
So they just think like, oh, well, I'm getting older.
Yeah.
I get winded going up the stairs.
Yeah, they just kind of brush it off.
But it could be COPD.
It could be, yeah.
Wow.
So that's why we're doing this deep dive,
Huh.
to help people recognize the warning signs.
Okay, so let's start with like the basics.
Okay.
What exactly is COPD?
So, it's actually not just one disease. It's a group of lung conditions that make breathing progressively harder.
Okay, so COPD is more like a category.
Yeah, you
Ah.
could say that.
Okay.
So the two most common ones under that umbrella are emphysema
Okay.
and chronic bronchitis.
Emphysema, that's the one that damages the little air sacs in your lungs, right?
Yeah, those trainee air sacs called alveoli.
Yeah.
You can almost imagine them like tiny little balloons
Okay.
that help your lungs take in oxygen
Okay.
and release carbon dioxide. And emphysema, basically what happens is those balloons, they lose their elasticity
Okay.
and they get all stretched out and trap air inside.
I could see how that would make it hard to breathe.
Yeah, it's definitely not good.
So what about chronic bronchitis?
Okay, so that's more like a constant irritation in your airways.
Okay.
Those are the tubes that carry air to your lungs,
Right.
and they become inflamed.
Yeah.
They produce way too much mucus,
Yeah.
and you end up with that persistent cough,
Yeah.
wheezing, and just general discomfort.
That sounds awful.
It's not pleasant.
And you said some people can have both of those?
Yeah, a lot of people actually have both emphysema and chronic bronchitis, and then some people even have asthma on top of that,
Oh, wow.
which is a lot to handle.
That's a triple whammy.
It is.
But
Yeah.
you're saying that if you catch it early and get the right treatment,
Yeah.
you can still live a pretty normal life.
Right. People with COPD can still live full and active lives.
Okay, that's good to know.
Yeah.
So, where does aging fit into this whole thing?
Okay.
Is COPD just an old person's disease?
Well, the risk does increase with age.
Yeah.
It's definitely not exclusive to older adults,
Okay.
but the statistics in this research are pretty striking.
Right.
So for Canadians aged 65 to 69,
Okay.
about 15% have COPD,
Okay.
but for those 85 and older,
Okay.
it jumps to 26%.
Wow. So as we get older, our lungs are more likely to.
They're definitely more vulnerable to COPD.
Yeah. Why is that?
Well, part of it is just the wear and tear our bodies experience over time. I mean, our lung capacity declines naturally as we age.
So even without COPD, our lungs aren't as good when we're older.
Exactly. They're not as efficient.
Mm-hmm.
And then you add in things like exposure to pollutants,
Yeah.
smoke, just the common cold.
Right.
All that stuff takes a toll over the years.
So all those things make you more likely to get COPD.
Yeah, they make your lungs more vulnerable.
But I think you were also saying that COPD is often underdiagnosed.
That's a big problem.
Yeah.
Yeah, especially in Canada.
Like, what do you mean?
Well, those early symptoms.
Yeah.
A little shortness of breath, a bit of a cough.
Right.
People just dismiss it as part of getting older.
Oh. So they just think it's normal.
Yeah, or maybe they think they're just out of shape.
But it could be a sign of COPD.
It could be, yeah.
So what should people watch out for?
Well, if you're getting winded more easily than you used to,
Okay.
or you have a cough that just won't quit,
Right.
don't just ignore it.
Talk to your doctor.
Right, talk to your doctor.
Okay, so early diagnosis is key. But what are the specific signs that it could be COPD?
Well, we talked about shortness of breath and coughing. There's also wheezing,
Okay.
that whistling sound when you breathe.
Right.
And as it progresses, you might start having trouble with everyday activities,
Okay.
like climbing stairs or even getting dressed.
Wow. So it can really affect your life.
It can, yeah.
But isn't it normal to feel a little out of breath as you get older?
Well, yeah, but it's about knowing your own body.
Right.
If you notice a significant change,
Okay.
like suddenly needing to stop and catch your breath after walking a short distance,
Okay.
that's a red flag.
So pay attention to changes.
Yes.
Yeah.
Don't just assume it's normal aging.
Okay, good advice.
And if you are experiencing any of those symptoms,
Yeah.
don't wait, see a doctor.
Okay.
Early intervention is so important.
Got it.
It can make a huge difference in managing COPD.
Okay, so we've talked about what COPD is and how it affects older people.
Right.
Now let's get into the risk factors.
Okay.
Obviously, smoking is a big one, right?
Yeah, absolutely. Smoking is the primary cause in over 80% of cases.
80%. Wow.
Yeah, it's a big one.
So if you smoke, you're pretty much guaranteed to get COPD.
Well, not necessarily.
Oh.
It's not just about how much you smoke.
Okay.
It's also about how long you've been exposed to smoke.
Oh, so even secondhand smoke counts.
Exactly.
So you could live with a smoker,
Right.
never smoke a day in your life,
Uh-huh.
but still be at risk.
Exactly.
Yeah.
And then there's all the other air pollution,
Yeah.
car exhaust, industrial fumes, even wood smoke.
Right.
All of that can damage your lungs.
It makes you realize how much crap we breathe in every day.
We do, yeah.
So smoking air pollution.
Mm-hmm.
And you said there's also a genetic factor.
Yeah, there's a rare genetic condition called an alpha-1 antitrypsin deficiency,
Okay.
but it's not that common.
So how do all these things actually cause COPD?
Okay, so let's picture those tiny air sacs in your lungs again.
The alveoli, these
Right.
little balloons.
Yeah, they're surrounded by these tiny blood vessels. And when you breathe in, air fills those balloons.
Right.
And oxygen passes into your bloodstream.
Uh-huh.
At the same time, carbon dioxide from your blood moves into the air sacs
Okay.
and gets exhaled out.
So it's like a gas exchange.
Yeah, it's a beautifully efficient system.
But what happens when you have COPD?
Well, with COPD, those airways leading to the air sacs, they
Okay.
become inflamed and thicken.
Oh.
Like imagine trying to breathe through a straw that's slowly closing in.
Okay.
Plus, your body starts producing excess mucus,
Yuck.
which clogs up those already narrowed airways.
So it's hard to get air in.
Exactly. And on top of that, those tiny air sacs, the alveoli, they start to lose their elasticity and even get destroyed.
Wow.
So they can't inflate and deflate properly.
Okay.
Air gets trapped inside.
Hmm.
And it's even harder to get oxygen into your bloodstream.
So it's like a double whammy.
Yeah, it's a tough situation.
So how do doctors actually diagnose this?
Well, the main test is a breathing test called spirometry.
Spirometry.
Yeah, it measures how much air you can breathe in and out
Okay.
and how quickly you can do it.
So they can see how well your lungs are working.
Exactly.
And based on that, they can tell you if you have COPD.
Right. And they can also determine the severity of your COPD.
Wait, there are different levels of COPD?
Yeah, there are 4 stages:
Oh.
mild, moderate, severe, and very severe.
So how do they decide what stage you're in?
Well, in the early stages, you might not have any symptoms
Okay.
or just mild shortness of breath during exercise.
Okay.
But as it progresses, the symptoms get worse.
So at what point does it become like a serious problem?
Well, the transition from mild to moderate is usually when everyday activities become a lot harder,
Oh, yeah.
like climbing stairs or walking short distances.
So if you suddenly find those things difficult,
Yeah,
that's when you should really get checked out.
exactly. Early intervention is key.
Got it.
And while there's no cure for COPD,
Right.
there are effective treatments and lifestyle changes that can help.
Okay, well, let's talk about those treatments.
Okay.
What are some of the options?
So one of the most common treatments is inhalers. There are different types, including bronchodilators, which help open up the airways,
Okay.
and steroid inhalers, which reduce inflammation.
So the inhalers are directly targeting the problems we were talking about.
Exactly. They're designed to address the constricted airways and the inflammation.
And what about for people with low blood oxygen?
For those folks, oxygen therapy might be recommended.
Oxygen therapy, what's that?
Well, it involves using a portable oxygen tank
Okay.
or a concentrator to supplement the oxygen you're getting from breathing.
So it helps you breathe easier.
Yeah, it gives your body the extra oxygen it needs.
So inhalers, oxygen therapy, are there any other options?
Well, there's also surgery,
Surgery.
but that's typically reserved for severe cases
Oh, okay.
that haven't responded well to other treatments.
So it's kind of a last resort. What
Mhm.
kind of surgery?
Well, there are a few different types, like lung volume reduction surgery or even lung transplantation.
Wow. So pretty major stuff.
Yeah, it's not something to take lightly.
So surgery is an option, but it's not the first line of treatment.
Exactly.
But you were saying that lifestyle changes are also really important.
Yeah, they're crucial for managing COPD.
Like what?
Well, first and foremost, if you smoke, you need to quit.
I figured you were going to say that.
It's the single most important thing you can do
Okay.
to slow the progression of the disease and improve your lung function.
But quitting smoking is so hard.
It is. Yeah, but it's worth it.
And there's help available, right?
Absolutely. Talk to your doctor. There are programs and medications that can help.
Good to know.
And remember, it's never too late to quit.
Okay, so quitting smoking is number one.
All right.
What else?
Regular exercise is also really important.
Even with COPD?
Even with COPD.
Really?
Yeah, even gentle walking can make a big difference.
Okay,
It helps strengthen your breathing muscles.
so it's not just about your legs.
No, it's about your whole respiratory system. Okay.
And it improves your overall fitness.
So you're saying that even if you have COPD,
Yeah.
you should still try to exercise?
Absolutely. Talk to your doctor or a pulmonary rehabilitation specialist.
Okay.
They can help you create a safe and effective exercise plan.
Okay, this is all really helpful information.
Good. I'm glad.
So just to recap the most important things for our listeners to remember about COPD,
Okay.
especially when it comes to older adults.
Well, first, be aware of those early warning signs.
Okay.
Shortness of breath, persistent cough wheezing.
Right.
Don't dismiss those as just a normal part of aging.
Because it could be COPD.
Exactly. Early diagnosis is key.
Neda?
And remember, COPD is manageable.
That's good to know.
There are treatments, lifestyle changes, support systems available to help you live well with it.
Well, this has been a great overview of the physical aspects of COPD.
Yeah.